Osteoporosis is really a major problem in our modern society. We have pretty much an epidemic of it happening where about 20 million women over the age of 45 are affected by thinning bones. That's almost 1 in every 4 women over the age of 50. So our medical community is in an uproar about it. They want to stop this tide of this bone disease that's making women have more bone fractures. And part of this fervor to quell the tide is that bone fractures are not just minor things. In fact, when women have hip fractures, the most common kind of fracture, they often end up in nursing homes, and they often end up with other problems and they often end up dying earlier associated with that hip fracture. So we know hip fractures aren't minor. They're major problems that really impact women's health and mortality. So in that fervor to quell that tide, modern doctors reach for medication. It's just their impulse. It's what they're trained to do. And the medications really do make the bones denser. And if you've had a fracture already, these drugs are actually important. They help prevent future fracture. However, if you haven't had a fracture already, these drugs are actually questionable in my mind as a good choice. And I question them because they have side effects, like they can cause erosions in the esophagus, and they're associated with actually femur fractures, thigh bone fractures, and with a thing called osteonecrosis of the jaw. Not fun things to have happen to you, and significant problems if you happen to have them and your bones are already thin. So the way I interpret that is that these drugs, although they are making denser bone, they're actually making a poorer quality bone. So from my point of view, from a holistic point of view, a more natural approach, we'd rather support the body in making good quality bone. This is one of the major differences between modern medicine and more integrative medicine or holistic practices, is that there's a way of seeing the body as this incredible organism that's self-supporting and able to heal itself. So there's some basic principles that we apply to this approach to bone loss. The first solution, the first thing you have to do to build more healthy bone is exercise. Exercise, the act of moving your body against gravity, is what causes calcium to be put into your bones. Okay, so the force, the stress we put on our bones from exerting ourselves is what builds more density in the bones. So we have to exercise. The next point really is that we need calcium. Calcium that makes up the bulk of the mineral content in our bones. So we need calcium-rich foods. We need a whole foods diet, but in that whole foods diet we need calcium-rich foods, which include dairy products, leafy green vegetables, nuts and beans. And if you're not a vegetarian, you can eat fish, salmon, sardines, all are calcium-rich. So make sure to include those. And if you need more than that, than what your diet can provide you, then you can supplement. But ideally, we get the bulk of our calcium through our food. We know that that's a healthier way, that our body's more able to assimilate that calcium than the calcium that we take in pills. The third piece of kind of a holistic prescription is vitamin D. That vitamin D helps calcium get absorbed into the body. So if you have low vitamin D and you have a calcium-rich diet, your bones still might be weak because of that inability to take in the calcium that you're ingesting. Now, you might ask, well, how much do I need? Vitamin D, the RDA for vitamin D used to be 400 IUs a day. And now we're rethinking that maybe it's more like 800. And some folks, some scientists think that it should be more like 1,000 to 2,000 IUs a day. So that's the range that I tend to advise people, 2,000 to 4,000 IUs a day, especially during the fall and winter when the sun light isn't so strong. Just to review, vitamin D is made in our skin through the interaction from sunlight. And if there's not strong sun, then we don't make much vitamin D in our skin. So especially if you live in the northern latitudes, we need to take vitamin D in the fall and winter. And if you don't get much sun exposure, even in the spring and summer, I would take it all year round. So those three things, exercise, calcium, and vitamin D, are the foundation of building more healthy bones. Okay? On top of that, if you look at Eastern medicine, there's more to add to that prescription. Because Ayurveda sees bone loss as a sign that there's too much air element in the body. So there's too much air in the bones. The bones are too light. So Ayurveda's view is that if we have any kind of excess of air, to give ourselves the opposite qualities of air is what grounds or what pacifies or eliminates that excess. So how does that look? This air element is called vata, for those of you who are Ayurvedic savvy. So vata excess is pacified by a diet that's grounding, nourishing, stabilizing, comforting. So more protein, a little bit of oil, warm foods as opposed to cooked foods are all more grounding and satisfying than cold, raw, light foods. And then oiling our body. Oil is like the quintessential vata pacifier. So putting oil on your skin. Oiling your food is good, but oil on your skin is also helpful to not just nourish the skin and nourish the bones, but also to pacify the nervous system. Think about all the nerve endings you have in your skin and how putting oil on them is like soothing to your nervous system. And that's really the third piece in the Ayurvedic view, is that you have to address your nervous system agitation. So excess air quality makes us more agitated in our nervous system. So when we're stressed out, vata is rising. And so that stress actually impacts our bones. As we calm our stress down, as we create a peaceful, serene, grounded feeling in our nervous system and minds, we're actually helping to pacify the vata, which helps to strengthen bones. That concept's not very accepted in the medical community, and it's hard to explain it to a conventional doctor or physiologist. But from an energetic point of view, the act of grounding, stabilizing, calming the nervous system actually has an impact on all of our tissues, including our bones. So to summarize, from a holistic point of view, the treatment for osteoporosis is to exercise, to eat a whole foods diet that's very nurturing and grounding and calcium rich, to get enough vitamin D and to pacify or to nourish your nervous system. Don't forget that part, that practicing yoga, meditation, tai chi, deep breathing exercises, whatever you do, prayer, things that help you feel grounded and contented in yourself, actually are really important pieces to this healing of your bones. I've seen multiple people in my practice get stronger bones by following this prescription, and you can too.